Welcome to Break the Rules with Dr. Lauren Lax, a podcast dedicated to quieting the noise in the health, food, and fitness world. Dr. Lauren is a leading nutritionist, therapist, and functional medicine practitioner on a mission to help others thrive in their own lives, mind, body, and soul. And now, your host, Dr. Lauren Lax.
Well, hello. Welcome to another edition of the Break the Rules podcast, where we talk about quieting the noise in the health, food, and fitness world. And today, I'm super pumped to have my mold sister in crime, Dr. Jill Carnahan, on the show. And Dr. Jill is just an amazing functional medicine expert based in Colorado. She uses functional medicine to help her patients find the root cause of illness and identify nutritional and biochemical imbalances that may be contributing to your symptoms. And a lot of Dr. Jill's work is inspired by, you guessed it, experience, which is the best teacher. And she is just a wealth of knowledge. Not only has she been in the patient seat and lived it from recovering from mold and environmental illness, but also now is the change she wishes to see in the world and has just a really amazing following on her YouTube channel, as well as her just blogs that she puts out there in the blogosphere. She is the one you want to be Dr. Googling if you're going to be looking up any info on mold and anything also functional medicine related. So Dr. Jill, just thanks so much for coming on. I'm super honored to have you on the show. And if you could give us a little bit of background about who you are and really what got you doing the work you're doing in the world.
Oh, you got it, Dr. Lauren. And I am so excited to be here. And I just have to laugh because we've tried a few times and I've failed. And I am so excited that we finally got this nailed down and that we're here together. And just getting to know you, it's been such a joy. I just want to speak out to all your listeners. They already know you, obviously, but it is so great to have someone who has such a heart, spirit, soul for what she does. And so I'm honored to be here.
And I know you've also been, like what you said, getting on the show. You've been busy, obviously, writing a book, and kind of like about your experience in your life, and would love you to just kind of like on-ramp us to really, what got you inspired into this path that has chosen you too.
Yes. Yeah. So, it goes way back. I always knew I wanted to do, some sort of service kind of it's very interesting because I did bioengineering as an undergrad major. And I would have never been a great engineer because I really like people too much, but I did love the problem solving. And it was a neat foundation because what I feel like I do best is take really complex sets of data and find patterns and then problem solve for people. So I love to be kind of the detective for these complex cases. And whereas I remember in family medicine, when I first trained, there was a lot of my colleagues that didn't want the complex patients. They would, send them over to me. And I was like, oh my gosh, send me the complexity. I love problem solving. And I love I have patients now that bring in 3-4 inches of records and they're always apologizing. And I'm like, no, I really do enjoy the complexity. And I don't always have all the answers, but I always love to dig for them. So it goes way back with that piece of the puzzle. But then I was in medical school. I actually had looked at naturopathic and chiropractic and many other professions because my heart had always been a little bit more holistic oriented. But I ended up getting accepted to Loyola Medical School in Chicago. And I felt like if I really wanted to make change in the system, the best way was to actually learn the system that's predominantly still in the United States, which is allopathic medicine, at least for reimbursement, and then kind of infiltrate the system and make the change from within. And I'm glad that I did, just because it gives a credibility, and then I can really push the envelope with some of these things, because I always say I have the heart of a naturopath. I'm much more open-minded about holistic things. So 25 years old, third year medical student, I got breast cancer. And that was obviously a big deal, just kind of stopped my life in its tracks at that moment. And I had to make some decisions. Looking back, this is one reason I'm so passionate about environmental toxicity and chemicals. I grew up on a farm in central Illinois, and so I had lots of exposure to glyphosate and chemicals and organophosphates and endocrine disruptors like atrazine from a very young age. And I think that absolutely contributed to my breast cancer at that young age. So I was in for the battle of my life. And, breast cancer, it's so common now, we kind of forget the gravity of it, but especially in young women, the mortality of this is incredible. First of all, my chances of getting breast cancer were like winning the lottery at 25, like 1 in 250, 300,000. And then the second thing, I'm at Loyola, this big university center. And I was at that time in 2001, the youngest woman they had ever diagnosed with breast cancer. So kind of very unique in that sense. And I was with a group, I've mentioned this before at different times I've told my story, but I was with a young women's group under 40 that had been diagnosed with breast cancer and got to know these women during our treatment. And Lauren, I'm the only one still living in that group, which is just so profound. Like God had a purpose for my life. I feel like it was almost like an anointing of looking back. That was one of the most difficult things I had gone through at the time. And now we've talked about this before. It was such a blessing because I got an education through that I would have never gotten a million years of medical training. And that was a start. And I always joke that God has me as his guinea pig because I have gone through a lot. After that, I had Crohn's disease and celiac, pancreatic insufficiency, immune deficiency, and then mold illness. And all of these things that I've dealt with and overcome have given me such a compassion for my patients, and also just the knowledge and understanding that when you live it, it's a whole different level of knowledge, which I know you understand well.
Yeah, I know we can definitely relate on that front. And it's what drives the passion in being the change that we wish to see in the world now, both in medicine and just like in life. And thank you so much for sharing your story. It's just really, I think it's easy, like when we're on the other side of it, to be like, and this happened, and this happened, and then this happened, and here I am. And like, not like you have had a journey, and it is, I know, super inspiring for your patients, as well as hopefully those listening, that no matter what it is, like that thing, that disease, that imbalance, that diagnosis, that there is hope on the other side. And it's not just a panacea of taking a supplement or following a protocol either. And I know that like your faith is very important for you, for one, is just having that practice and that connection and that hope in something greater, I think is a big driver that both you and I can relate on. I know too, before we got on the show, we were talking a lot about just how the role of trauma, the role of like the chronic stress response and staying stuck in that chronic stress response can be really a catalyst for not only just one diagnosis, but multiple, or not being able to bust through those ceilings. And would love to talk to you some about that. I've been talking a lot about vagus nerve function in my practice, it seems like lately. And that just the vagus nerve, for the listeners listening, is the nerve that governs both digestion as well as just a lot of your brain function and autonomic nervous system, your body's parasympathetic rest and digest mode, and being in a state of just rest in the body. And so when that vagus nerve is disrupted from chronic stress, traumas, glyphosate exposure, et cetera, over time, that's just where the imbalances in the gut biome can occur, and just inflammation throughout the body. And it can be really get locked in. That limbic system, the memory of your body, can get trapped in this stress response, where both me and Dr. Jill have kind of like experienced that being like whatever that diagnosis was, maybe stuck there for a time, like mold illness being something recently I've overcoming, I would say. But Dr. Jill, I would love to know just kind of like lay of the land. Can you paint a picture for us of like how and why the stress response does keep the body so trapped in that? And really some of your work in that area of helping patients uncover maybe the root causes of that stress to start.
Oh gosh, I love this topic because, I've almost been 20 years in functional medicine practices. But what I've found in the last maybe 3, 4, 5 years is the real breakthroughs are happening when we like, for me, the supplementation, the diet, the lifestyle, the getting rid of toxic load, all of those basic treating the gut, like you mentioned, which is huge and foundational. Those principles are there. I do them. I could almost do them in my sleep. But the things that are taking people to the next level that are stuck are dealing with, like you said, the stress response, the limbic system, and even the vagus nerve. So some of the things there are so interesting. I've got a million thoughts, but just a few of them. One thing is that we all have trauma, and trauma used to be a word like the big T, like, oh my gosh, like kidnapping or rape, or these horrible things that people go through. And that is clearly trauma. But the truth is, you could have had a conversation with your mother and not felt like it was fair when you were 5 with your sister getting ice cream and you didn't. And there's something there that makes you feel like I'm not enough, and that I'm not enough gets stuck in your brain in a loop, and you go on to live your life as if you're not enough, and it actually can manifest in disease. Another thing is not taking care of ourselves, or dissociating from pain or anger or uncomfortable emotions. But all of these things, we all have them. We all have old patterns, and whether they're little t trauma or big T trauma, they do affect our immune system. For example, Peter Levine and Gabor Mate have done a ton of work around autoimmunity and self-care. So a lot of times there's a pattern around self-hatred, self-loathing, anger that's repressed, and developing autoimmune disease. And so a lot of people, we deal with the gut, which is huge with autoimmunity. We deal with hidden infections. We deal with environmental toxicity. But if you haven't dealt with repressed anger or unforgiveness or self-hatred or I'm not enough or some of these messages, sometimes you're stuck with that autoimmunity, and it's related to the messages that we have in our mind. So that's one thing. And then as far as the stress response, limbic system, and mold, which we've both experienced, so many of my patients, I don't have this all figured out yet, but what I know to be true, and literally 100% of the patients I've seen that have had significant mold exposure and mold illness, there's a trauma loop, and it involves the limbic system. And it's kind of subconscious because mold is this physiological trigger that's very, very dangerous. And I don't know if it starts with the fact that your home or your workplace or your car is no longer safe and it's a safety issue that triggers it, or if it's just the real physiological mycotoxin effects on the brain and the limbic system. And I think it's probably a combination of all the above. But there is literally this PTSD, this post-traumatic stress response that happens in nearly everyone who's exposed to mold. There's a fear around it. There's a fear of being re-exposed. There's a fear of getting sick again. There's a fear of, is my environment safe? Is my home safe? And so dealing with that in some way, I know like Annie Hopper's made DNRS really famous, but there's lots of other ways. That to me is just like icing on the cake, really going deep with somatic-based trauma therapies and a therapist who's trained in that. Things like EMDR, thought-field therapy, brain spotting, all these strange terms that involve looking at the subconscious programming around a trauma or a threat. And mold is a very, very real threat in that realm. So I feel like people get to a certain point of wellness, and then that next level is dealing with that limbic loop. I think you're the one who mentioned limbic loop first, that I heard it, and I love that term.
Yeah, no, thank you for explaining that, just lay of the land. And I feel like that word trauma, I'm glad you explained that as well. I used to think of it as like, okay, like the death of a loved one, or like maybe a sexual assault, something like, or a car accident that was really traumatic. But how you mentioned, like, it can be like the littlest of things. And I know in my own history, like I think back to being that 9 or 10-year-old girl, that trauma of being told I was basically 10 pounds heavier than the little girl I wanted to look like,
Yes.
but carrying that home with me. And it's very unaddressed in the moment until years later that I even realized that happened. And so for the listeners listening, to think through those little, they can just be the little minute things that can add up to, that wasn't then only an isolated event. There were other little events like that in my young life, but to not discount those. Dr. Jill, when you're working with a client and like explaining that, does it feel like it goes in one ear out the other? Because like, it didn't really go into my ears until really being a clinician and also helping patients through this and realizing like, whoa, wait, this trauma thing, like even in my own life, that's really, I understand it more.
Yes. So I love that you say that, because some people aren't ready. And it's interesting because I've just been, as I'm writing my book, one of the things recently I was writing about is how like medical school teaches dissociation. So like what I mean by that is my medical training, and I talked to another surgeon that I know, and we were just like comparing stories, basically like, oh yeah, we have this high pain tolerance. If there's something happening that's really, like a car accident, we can just be perfectly, calm, take care of things, and not affected by it, or so we think. But the truth is, you're trained in medical school to kind of rise above. But the only way you can do that is you have to suppress your own response, your own emotional response to horrific things. Like I remember in the Loyola burn unit, people who were 80% of their body was burned. And it was the most horrific thing I've ever seen, the surgeries they involved. But I had to suppress that and deal with it and help them. And I promise I'm getting to a point here, but what I was going to say about this is that whole dissociation is trained in many areas of life. If you want to be successful and tough, and especially if you're a woman in a male dominated field, we're taught to just be very, very masculine in our drive, in our intent, in our suppression of softer emotions, and often suppression of fear or anger or suppression of your sensitivity. And I've learned in the last several years that, number one, I thought I was this driven, high pain tolerance, not affected kind of person. The truth is I'm really freaking sensitive. And as I've embraced that, I've become a better physician. I've become a better listener, a better friend, a better partner, all of these things, my relationships in my lives. I'm so much healthier when I come as the true version of myself, which is, yes, I can be tough, but I'm also very sensitive and embracing both parts of myself. So your original question was, how do you get through to the patients? So number one, I'm listening, and I'm listening for patterns, just like I said in the beginning. And then when I see these things, I'll just ask questions. So do you ever feel, when you're in a room with people, like you're all alone? Or do you ever feel like, oh, you rarely get angry? Or I just ask questions, because all of a sudden, if I listen enough and listen carefully enough, I will be able to ask them a question. And the thing that I know I've hit the nail on the head when I get the response, how did you know? They look at me with wide eyes and how did you know that about me? And it's just listening over the years and seeing patterns and calling people out to those. But once you get that, how did you know? Like they feel like you get them at that level. They're open. And I've found that, again, I don't always get it right, but if I'm really careful in listening and just mirroring back to them what they're saying, and then asking questions, probing questions about how they felt, how they grew up, how their relationship with their parents was, what they deal with in their intimate relationships, how they deal with their children, they start to feel heard and seen in a new way. And once they feel that, they feel like they truly are being seen, like something that no one's ever seen about them, they are really, really open and receptive to hearing what I might have to say about, well, do you think maybe that this trauma in your childhood with your relationship with your parents could have, and again, it could be minor. It could be just a parent who was working a lot and not available, and they feel like they were abandoned. These are things that we all go through in different levels, and we don't call them big T trauma, but they're traumatic, and they affect how we live our life and how our physiology manifests disease or illness.
That's really a good listener you are. And just, I know, insightful, just again, from your own experience as well. When you so have that aha moment with a patient, what are the steps? Do you have several therapists in your area that you typically will refer out your patients to? Or what kind of active work can people begin doing? And what is typically the timeline that you've seen in practice where it does begin to pay off? Because it's like doing push-ups in a gym. You can't just do one push-up and then expect to get stronger. I know it's a process.
Yes. Oh gosh. And this is where it's like you and I have talked about, like remediators and inspectors and people that are in the environmental world of mold. We cannot do that piece, right? Like we need these people that are good at whether it's remediation or inspection or whatever. And so the same thing with this realm, I know enough about it to be what we call trauma informed. So in fact, I'm helping my neuropsychologist friend, who's my best resource in the world, to develop a trauma-informed interview or some trauma-informed information for clinicians and practitioners, just so that they have some idea, like what we're talking about, like what kind of questions should I ask? Because so many doctors, so many practitioners are afraid to go there. Like, oh, I don't know. What if she says, oh my gosh, I was in a horrible car accident, or some big trauma comes out and I don't know what to do with it. So a lot of doctors or clinicians are afraid to go there. So the first thing we need to do is give them resources of simple questions, simple things. And it's called a trauma-informed interview. And my friend, Dr. Eileen Naomi Rusk, is working on that. So hopefully she will have that out soon. And I'm happy to share that with you, to share with people. But so that's where it starts. And then the second thing is what to do. So yes, the types of things people are looking for are somatic-based trauma therapy. And again, I always have to explain that word trauma, because people are like, oh, no, I don't have trauma. And we all think that, but we all have some. So it's somatic-based trauma therapies. What this is, the difference between cognitive behavioral therapy is amazing. That's talk therapy. But when you're dealing with the body level, these subconscious patterns, it is on a subconscious level, and you have to deal with it on a subconscious level. So you're really reprogramming the subconscious, and ways to do that within somatic-based trauma therapies. There's a lot. EMDR is one that a lot of people know about and have heard about. So is brain spotting. It's really, really popular here in Boulder, where it originated. It's not quite as popular all over the US, but it's another pretty simple way similar to EMDR. A lot of the just getting in nature and getting in touch with your emotions. So you can do some of this work on your own. Neuro-linguistic programming is another method that I found really helpful myself. Just changing the language around what we're telling ourselves and the messages and things. And for me, those have been really profound shifts, because I want something to happen quickly. And when I go into an NLP session, like within that 1 hour or 90 minutes, by the time I come out, there's something that shifted, and it's permanently shifted. So it's been pretty profound. And then just getting, like I said, meditation, walking in nature. For you and I, my connection with God and my prayer is so profoundly beneficial on this level, because, a lot of that healing takes place on a spiritual level too.
Mm-hmm. And we really like what you're even saying about the NLP, and just, we are the stories we tell ourselves. I think comes to mind, and
Yes.
like how, and even on the faith piece of like, just really having a rest and a peace, and something beyond the struggle or the anxiety or the will, that it's on our own merit, the healing process. So like, just from like timeline and even your own life, like as you began to like maybe by force have to like take these paths for healing, and just if you wanted to bust through some ceiling,
Sure.
what was the timeline like for that? And are these tools that you continue to go back to, like, or whenever you feel out of balance yourself, like have to reawaken?
Oh, that's a great question, because it's funny, because I kind of thought, oh, I'm going to do the work and then I'll be done. And with this work, you're never done. You're always growing in some way. It doesn't mean you always have to have therapy once a week or anything like that. But so my story is, I love the word dissociated, in the sense of I didn't realize I was dissociated, but I really was. What that means is, basically for me, I was super optimistic, happy, loved life, but I never allowed myself to feel anger or sadness, because those were, in my culture growing up, they weren't okay for a young woman to feel. You don't get angry, and you'd be happy, be cheerful. Faith. And I grew up in a faith culture with Christian parents and an incredible, incredible family, but there was still, there wasn't a lot of allowance for sadness or fear, because it was almost like you didn't have enough faith, or at least that was my perception. I'm sure that's not what I was being told, but growing up, that's kind of how I felt. So it took until I got divorced in 2016 for me to really dive deep, because after that point, when my life kind of fell apart, or the illusion of what I thought my life was fell apart, I was like, okay, I'm going to go deep and dig deep and find out, number one, you can always point fingers, whether it's relationships, coworkers, even your own health and illness. You can say, well, it's so-and-so's fault, or it's the mold's fault. And we can play the blame game. But the only real lasting change comes from us looking at ourselves and starting, we're the only thing we can change, and we're the only thing we have control over. So I really dove deep and said, okay, my marriage fell apart. What can I do? How can I look at myself? And I started with some neuro-linguistic programming, did EMDR, all the stuff I'm telling you. But what happened is I realized that I was living from the neck up in my head, very analytical, and I wasn't really in touch with my emotions, and I wasn't really in touch with what my body was feeling. We just talked earlier before we got on the call about having this sense of peace around both of us that had big decisions that were really hard, and we had a sense of peace, like a relief afterwards. And we were talking about how that sense of peace for me is always a confirmation that I'm doing the right thing. Like I just have this overwhelming sense of relief and peace. And even if the decision was hard, I'm like, oh, this is right, because I know I have this sense of peace. Before, when I was more dissociated, I may not have been in touch with myself enough to realize or to acknowledge or to feel that peace. And now, just talking about giving a real example of how that feels, or you might feel sadness, or you might feel anger, things that I didn't allow myself to feel before. And now, instead of like running away or trying to suppress it, I will actually just sit with it. I'll say hello to it. I'll let it come through, and it passes, and I'm fine. And instead of feeling like, oh no, the world's going to end if I get angry or sad, I know that I can handle it. And by letting it pass through, it doesn't get stuck in the tissues and cause illness.
Mm-hmm. You're more awareness at this season. And I just, as you talked about peace too, I just like, I do feel at peace. And it is such a good, I call that going with your gut too.
Yes.
That gut feeling, in many ways can be a really powerful thing for, I think, whether it's decisions we have to make in our lives, or even like when you're in the healing process and maybe making decisions about like the treatments to pursue or not, or whether to keep pushing or whether to just be and have seasons of that too in your healing journey. And so thank you for speaking to that. Well, Dr. Jill, I could talk your ear off all day long. Where can people find out more about you, though, the work you're doing in the world, and also your YouTube channel?
Oh, thank you, Lauren. I love that you ended on that note too, because I have patients all the time who are like, oh, that feels like it's too strong. Or, when you do an intense, like there's never a one size fits all. So one thing I want to leave your listeners with is if you're in a treatment protocol or you're trying to get well and you intuitively feel like it's too much or too fast or not enough, your body really knows. And I would encourage you to talk to your practitioner or the people that you have in your life that are helping you to heal, and really make sure that you do listen to your body. And you might be going slower than what's normal or faster than what's normal, or taking less or more, and your body knows. So I love that you said that and just wanted to emphasize. And then where can you find me? Well, I have my website, jillcarnahan.com. Tons of free content, as you mentioned, blogs every week there. Brand new YouTube channel. If you just look on YouTube and look up Jill Carnahan, you will find it there. There's a new Dr. Jill Live playlist that has tons of great interviews. They're all free. And you and I are on there, Lauren. So episode 21, you want to be sure and listen to Lauren there, Dr. Lauren.
Thank you so much, Dr. Jill. I'll put your links in the show notes as well. And thanks for helping us just really break some rules, I would say, in an area that's not really always addressed or talked about enough when we're thinking about like healing from whether it's mold illness or IBD, or just really any ceiling we're hitting in our health. And so, Dr. Jill, thank you so much.
You're welcome, Dr. Lauren. Thanks for having me.